Jordan has taken consistent steps on the path of reform and development, achieving many successes that has placed it among leading modern countries. Jordan is a model for continuous progress and development under the guidance of His Majesty King Abdullah II and the efforts of its devoted citizens. The population in Jordan has increased more than tenfold over the past 55 years due to population growth and migration. The greatest population increase took place in 2011 due to the Syrian refugee crisis, which negatively impacted the country's economic growth. This adverse effect on economic growth placed significant constraints on Jordan's limited resources and its development efforts. The population in Jordan has reached 9.5 million. 6.5 million of them are Jordanians, while the number of non-Jordanians is around 3 million, accounting for 30% of the overall population. Jordan is a young country. Children and youth below the age of 25 account for the largest proportion, 54% of the population, and the country's total fertility rate remains high at 3.38. If Jordan's current total fertility rate continues, the Jordanian population will reach 9 million by 2030 and more than 30 million by 2050, compared to around 8.5 million in 2030 and 10.5 million inhabitants by 2050 if the total fertility rate drops to 2.1. Jordan is on the verge of a major demographic transformation in terms of its population age structure known as the demographic dividend, which occurs when the proportion of working people aged 15 to 64 exceeds that of the dependent age groups below 15 and above 64. Jordan is expected to reach a demographic dividend by 2040 when the proportion of working people is at its peak, which will result in improving the standard of living for Jordanian society. Economic and social policies on the national and sectoral levels are needed to benefit from the demographic dividend. The increase in population due to the persistence of high fertility rates will be a burden on the kingdom's successive governments given the scarcity of resources and will hinder its future development efforts. Let us take the health sector as an example. This level of population growth will exert huge pressure on the government of Jordan, and particularly on the country's health facilities, doctors, and nurses. If fertility rates remain constant, the cost of healthcare will increase from around 2 billion JDs in 2015 to more than 4 billion JDs by 2050. But in the event of a decrease in fertility rates, the cost of healthcare will only rise from 2 billion JDs in 2015 to about 3.5 billion JDs by 2050. Therefore, low fertility rates will result in saving 11 billion JDs in healthcare costs between 2015 and 2050. Jordan's education sector will also need to rapidly expand its services to keep up with the current rate of population growth through establishing new schools and recruiting more teachers to accommodate for the increasing numbers of students. The overall cost of students and teachers is estimated at about 56 billion JDs in comparison with about 45 billion JDs if the fertility rate declined. The cost difference is approximately 11 billion JDs over the coming 35 years. This population growth will also impact the country's infrastructure, environment, food supply, per capita share of energy, and limited water supplies, along with other social factors including higher crime rates. The points addressed here concern Jordanian citizens, but the impact is not limited to them. Jordan hosts a large number of refugee and foreign workers, which has a notable direct effect on the country's economic and social realities. This also increases the burden on basic services given the nation's limited resources. The government has estimated the additional requirements and needs of Syrian residing in Jordan at about 5.5 billion JDs between 2017 and 2019. As we have seen, the sudden and unplanned rapid population growth rate generates stark challenges that affect all sectors of development. Jordan's public and private institutions, along with civil society, need to work together now more than ever to reduce the acceleration of population growth, to save Jordan billions of JDs over the next 30 years, to contribute to achieving the demographic dividend, and to improve the economic and social reality and well-being of Jordanian citizens.